One of the really crucial components of general practice across Australia, and particularly in rural areas, is that real dependence we've got on our international medical graduate colleagues. So often we see these people come to Australia ready to make a fantastic contribution, and we really do value the role that they play. But even at a college level, we find that we might see them at our fellowship ceremonies or occasionally, but then we just lose touch. Anita, how would you better engage with and support our IMG colleagues as they move through into our profession?
Thanks, Konrad. And there's two components to my answer to this. There's what can we do to support IMGs outside of the college, and what can we do to support them within the college. When it comes to outside of the college, I very strongly believe that we need to change the narrative around international medical graduates. There is a negative narrative that has existed in Australia now, certainly for as long as I've had my licence to practice, and we need to remove that negative sentiment and in its place put what is appropriate, which is a recognition and a celebration of the fact that we have amazing people who come from other countries to Australia, and they are willing to serve the Australian public for the whole of their lives or their careers. So I want a positive narrative to be out in the media, in the public, definitely with government, in recognition of the fact that were it not for IMGs in Australia, our health system would have collapsed decades ago. And so we need to celebrate the fact that people who have come to our country to set up their lives and to serve Australian patients have done a huge service. Internally, I think there are quite a few things that can be done, both inside the college and its culture, but also with regard to the processes that IMGs have to deal with when they're trying to set up their capacity to practice here. So I think we need to be welcoming. I think we need to invite IMGs into spaces, not only to get help with training, but to socialise, to set up communities of practice, to support, such as concierge services, so that you can settle into new towns, make friends, and have a successful way of life, not just a successful training experience. I also believe there are many instances in which systems clash with each other to the disadvantage of the IMG candidate. And there is a role for the RACGP with government and with regulators to point out that we apply significant time pressures on IMGs that overlooks the fact that actually leaving your country and coming to another country is a really big deal. And we need to advocate for there being more time, more flexibility in some of our AMC and APRA and visa processes, and more flexibility inside of the college as well, to give people the time and the capacity to be successful and not just make it across the line of training, but actually thrive and feel welcomed into Australian general practice.
That's wonderful. That's lovely, Nate. Thanks for that.